Hello everyone, myself Dr. Namrata Vitlani. So today we will discuss regarding the cyanosis. So cyanosis, it is the abnormal bluish discoloration of the skin. According to the etiology, the presentation may vary. Central cyanosis, it mainly involves the tongue and lips, while peripheral cyanosis involves the palms and soles. Now, etiology of both are different. In the central cyanosis, the pathology is basically it lies within either the abnormalities or diseases of the heart or the respiratory system. And the peripheral cyanosis, it is due to the local peripheral vasoconstriction or vasoocclusion. So, the heart and lungs per se are normal. Central cyanosis, it is often associated with the peripheral cyanosis or a mixed, it is called as the mixed cyanosis when both are coexisting. So let us have a look at the etiologies. So central cyanosis, the main cause is, if we look at the congenital causes, congenital cyanotic heart disease such as transposition of the great arteries or tetralogy of the phalloid, and whenever there is a left to right shunt and the reversal occurs, that is the right to left shunt, Eisenmanger's syndrome develops. So that also presents with the cyanosis. So TGA, transposition of the great arteries, TOF, tetralogy of the phalloid, and Eisenmanger's syndrome. So these are the congenital causes. If we look at the other cardiac causes, they include the left ventricular failure or a heart failure, advanced heart failure. It may be leading to the cyanosis, central cyanosis. In the heart failure, we can also see sometimes the mixed cyanosis, that is the peripheries are also cyanosed due to the peripheral vasoconstriction in cases of the due to the shock, inadequate cardiac output. So refractory cardiac failure, advanced heart failure associated with the peripheral circulatory failure or shock, it might present with the central and peripheral. So that is the mixed cyanosis. Here we have a picture. Patient is having the palms which are cyanosed. Basically this patient was having the mixed cyanosis, that is patient is having ARDS, severe LV dysfunction, so heart failure and pulmonary edema, both cardiorespiratory causes are there, and patient is also in the shock. So and requires the high vasopressor support. So due to the peripheral vasoconstriction and shock, patient is having the cyanosis. So that is the one example. So heart failure and cyanotic congenital heart disease. Now sometimes the associated findings also may give the clues towards the etiologies, that is the chronic central cyanosis associated with the clubbing. It is often seen in patients with the congenital heart disease, that is the cyanotic heart disease. So clubbing with cyanosis, central cyanosis, it might be found in the transposition of the great arteries or any congenital heart disease. And in the cardiac other causes, heart failure, it is an important etiology. Now moving forward to the respiratory causes or diseases involving lungs, they include the ARDS, that is the non-cardiogenic pulmonary edema, or a pneumonia, and COPD or pulmonary embolism. So all these advanced stages, basically the cyanosis, it becomes apparent when the SpO2 falls below the 80 to 85, although depending on the skin thickness and tone, this may be variable. And also the amount of hemoglobin, it is also important. Generally when deoxygenated hemoglobin, it increases beyond 5 gram, the cyanosis becomes apparent. So in the severely anemic patients, the cyanosis, such as HB less than 5, the cyanosis might not be apparent. And similarly in the patients with the polycythemia, even mild hypoxia can lead to the cyanosis. So this is what we discussed are the causes of central cyanosis and mixed cyanosis, cyanosis with the clubbing, And in the peripheral cyanosis, the etiology is basically local, so such as in the exposure to the high cold weather and Raynaud's phenomenon. These are the etiologies for peripheral cyanosis. Thank you.